Hello, everyone, and welcome to today's presentation. I'm excited to have you here as we explore the roots of drug administration. The title of our talk is Roots of Drug Administration, and we'll also look into how different methods impact treatment. Today, we'll cover the main routes such as oral, intravenous, intramuscular, subcutaneous, and topical methods. We'll discuss how each route influences drug effectiveness, patient compliance, and overall outcomes. By the end, you'll have a clear understanding of how choosing the right route can optimize patient care. Let's get started. Let's start by looking at oral administration overview. It's called common and convenient for a reason. This route is actually the most widely used because it's simple to take and generally preferred by patients. When we think about patient compliance and ease of use, oral administration really hits the mark. However, it's important to understand that absorption of drugs taken this way can vary quite a bit. Factors like what you eat, whether the stomach is full or empty, and the pH level in the gastrointestinal tract can influence how much of the drug gets into the bloodstream. This variability is something we need to consider when prescribing or administering medications orally. Another key point is the first-pass metabolism. Before the drug even reaches systemic circulation, it first passes through the liver. In this process, some of the drug is metabolized and broken down, which means less active drug actually makes it into the circulation than originally administered. This can significantly reduce the bioavailability of the medication. All these factors, ease of use, absorption variability, and first-pass effect, are vital to understanding how oral drugs work and how we can optimize their effectiveness in treatment. They highlight the importance of considering individual patient factors and the pharmacokinetic processes involved. Let's talk about parenteral administration, specifically injections. These routes include intravenous, intramuscular, and subcutaneous methods. They are particularly valuable because they allow for precise control of the dosage and produce rapid effects, which is especially important in emergency situations. For instance, when immediate action is needed, IV administration is often the go-to method. Focusing on IV administration, it offers the advantage of delivering drugs directly into the bloodstream, resulting in an almost instant onset of action. This rapid response can be critical when managing acute conditions like infections or severe pain. Now, when we look at intramuscular and subcutaneous injections, these are especially useful for depot formulations. These are designed to release the drug slowly over time, which helps maintain consistent therapeutic levels. This extended release can improve patient adherence as it reduces the frequency of dosing and ensures the medication works steadily over a longer period. Overall, understanding these routes helps us choose the most appropriate method based on the clinical situation, balancing speed, patient comfort, and medication stability. Let's talk about topical administration, which is a method of localized treatment. This approach involves delivering drugs directly to the specific area that needs treatment, which helps in minimizing potential side effects that might occur if the drug were distributed throughout the body. It's a very targeted way to ensure the medication works precisely where it's needed. When it comes to formulations, there's quite a variety available. Think of creams, ointments, gels, and patches. Each of these has unique advantages and is suited for different types of conditions or patient preferences. The diversity in formulations allows healthcare providers to tailor treatments more effectively. Another key point is patient compliance. Topical treatments often improve adherence to long-term therapy because they can be easier to use and less invasive than other methods. When patients find a treatment manageable and comfortable, they're more likely to follow it consistently, which is crucial for successful outcomes. Overall, topical administration plays a vital role in modern medicine by providing targeted, flexible, and patient-friendly options that support effective and sustained treatment. Let's talk about inhalation administration. First, it's a preferred route for respiratory conditions because it allows medications to be delivered directly to the lungs. This means the drugs can act quickly, providing rapid therapeutic effects when needed most. Next, the importance of particle size cannot be overstated. The size of the aerosolized particles determines where they deposit in the airways and lungs. Smaller particles can reach deeper into the lungs, making the treatment more effective, while larger ones tend to settle in the upper airways. Finally, patient technique is absolutely critical. Even the best medication won't work optimally if the inhalation isn't performed correctly. Proper technique ensures maximum drug delivery, which is why patient education and training are so essential in inhalation therapy. Connecting this to the overall theme, successful inhalation therapy relies on understanding these key factors: rapid delivery, the right particle size, and correct technique, all working together to improve patient outcomes. Let's take a closer look at transdermal administration. One of its key benefits is the ability to provide a steady drug release. Transdermal patches deliver medication continuously through the skin, which helps maintain stable plasma levels over time. This steady release can also reduce how often patients need to apply new doses, making treatment more convenient. Another important point is that this route bypasses the gastrointestinal tract and the first-pass metabolism in the liver. That means more of the drug actually reaches the bloodstream, which can improve bioavailability for certain medications. This is especially useful for drugs that are heavily metabolized when taken orally. However, there are limitations to consider. Not every drug can be administered this way. Only drugs with specific molecular weights and lipid solubility are suitable for transdermal delivery. This limits the range of medications that can effectively be used through this route. In the broader context of drug delivery strategies, transdermal administration offers unique advantages, but also specific constraints based on drug properties. Understanding these factors helps us choose the best route for each medication. Let's talk about rectal administration as an alternative route for medication delivery. This method is particularly useful for patients who are vomiting or unable to take medications orally. It provides a way to deliver drugs when swallowing isn't an option. One key point to remember is that absorption through the rectal route can be quite variable. It's not always predictable, which means the amount of medication that actually enters the bloodstream can differ from person to person. However, an advantage is that it can bypass some of the first-pass metabolism that happens in the liver with oral medications, potentially increasing the drug's effectiveness. This route is commonly used for medications like antiemetics, which help control nausea and vomiting, and analgesics, especially in pediatric patients who might have difficulty swallowing pills. So, while it might not be the first choice for every medication, it's a valuable alternative in specific situations, fitting into our overall theme of flexible and patient-centered drug administration options. Let's talk about the clinical importance of administration routes. First, choosing the right route is crucial because it directly affects how the drug is absorbed, distributed, metabolized, and eliminated, what we call pharmacokinetics, and how it actually works in the body, or pharmacodynamics. This choice impacts the overall effectiveness of the treatment plan. Next, we need to consider patient factors. Age, overall health, and even patient preferences play a big role here. By tailoring the route to the individual, we can improve adherence and, ultimately, the therapeutic outcome. Finally, in emergency situations, the route of administration becomes even more critical. Rapid response is often necessary, especially in life-threatening conditions. The right route can make the difference between a quick, effective treatment and a delayed response. So, understanding and selecting the appropriate route based on these factors is key to providing safe, effective, and patient-centered care. So, to wrap up, let's talk about the importance of understanding the diverse administration routes for drugs. Recognizing the different ways medications can be delivered is crucial because it allows us to optimize treatment strategies and ultimately improve patient outcomes. When we choose the right route, we're not just ensuring the drug works effectively, we're also helping minimize side effects and making the treatment more tolerable for patients. This leads us to the clinical applications. Selecting the appropriate route based on each specific scenario can really make a difference. Whether it's oral, injectable, or topical, the choice impacts how well the drug works, how quickly it acts, and how compliant the patient is with their therapy. Looking ahead, ongoing research into new drug delivery systems and innovative administration Roots promises to keep evolving our practice. These advancements will shape the future of pharmacotherapy, making treatments more effective, targeted, and patient-friendly. So, understanding these roots and staying informed about future developments is key to providing the best possible care.